The assessment can be done anywhere. It doesn't have to be within the confines of an arena. We've also demonstrated that the ethogram can be applied with equal accuracy either to live horses or to good quality video footage of horses. I would highly recommend the inclusion of 10-meter diameter circles performed to the left and to the right in circular figures of 8 in rising trot, because this will frequently highlight both abnormalities of gait and also increases or changes in the behaviours exhibited. There are some important features that you need to be aware of before evaluating the horse ridden. You need to look at the arena surface or the length of the grass. If the arena surface is too deep or the grass is very long, you will not be able to evaluate accurately the presence or absence of a bilateral hind limb toe drag. Look at the eyes. Is the sclera visible in one or both of the eyes at rest? If the answer is yes, as in the horse's right eye on the left, then the behavior exposure of the sclera will not be able to be applied to that eye. Look also at the width of the canons of the bit. If the bit is too wide for the horse's mouth, take care when applying the behavior, bit pulled through to one side. A number of the behaviors are timed behaviors. So, for example, mouth open with separation of the teeth for 10 seconds or more. When you're starting out, I think it is important to actually time each behavior to be sure that it fulfills the criteria of the ethogram. So let's consider under what situations we as veterinarians can apply the ridden horse pain ethogram. We can use it to educate an owner of the presence of a problem, despite them being unable to recognise overt lameness. It facilitates the identification of the presence of a problem that may be subclinical in most people's eyes. It can be used at pre-purchase examinations, including pre-screening. I think it's valuable to assess video recordings before driving 150 kilometers to go and examine a horse. It can help us give objective information about saddle fit, because a poorly fitted saddle can induce discomfort and abnormal behaviours. We also can use it to help to discuss with an owner their size relative to the horse's size. And this includes height and shape as well as body weight. We know that if the weight is distributed inappropriately, then this is associated with higher ridden horse pain ethogram scores. The use of the ridden horse pain ethogram provides us with an additional way of assessing the response to nerve blocks, in addition to looking at the improvement in lameness or gait quality. It also provides a semi-objective means of evaluating the response to treatment. We can also discuss with riders and coaches the potential value of the ridden horse pain ethogram score for them. It facilitates the differentiation between a training problem and a failure to progress because of underlying pain.